The number one question you should ask is, of course, about their qualifications. You want to find out, are they board certified? That's critical. You also want to find out what kind of experience they've had, especially if the delivery may be more complex. You want to ask about their experience in complex deliveries and where they had it. Very often you want to ask not only have they had a residency and passed their boards, but also have they had a fellowship training someplace. Of course, you want to ask about their hospital appointment. You want to ask also about the health plan, because that's critical. Nobody wants to make a mistake and go out of network with a pregnancy and a birth, because it could be incredibly, incredibly expensive. So you want to try to find a doctor in your health plan. Now, everything else has to apply. You want to find a well-qualified doctor in your health plan, not one just because they're in the health plan, because your health, the health of your baby, your life, your baby's life is a lot more important than the money involved. But usually you can find a very competent physician in your health plan. Lastly, you want to ask about the doctor's colleagues, because it's not always the case that the obstetrician you're seeing is the one who ends up delivering the baby. And very often what a group will do is make sure that during your pregnancy, when you come in for your appointments, you've met everybody in the group. So if you do go into labor and the physician that you identify in effect as yours isn't doing the delivery, you've at least met the other physician who will, and they've met you. And so that's an important thing. Ask about colleagues, ask about the group, because they're every bit as important as your physician.